and welcome to yet another episode of House of Wellness. It gives me immense pleasure to introduce to everyone Dr. Mazda Turel. He is currently practicing as a neurosurgeon at the prestigious Wockhardt Hospital, South Mumbai, as well as assistant honorary professor at his alma mater, Grant Medical College and Sir J.J. Group of Hospitals. Dr. Turel is a general practice neurosurgeon who specializes in the treatment of diseases of the brain and spine and advocates an approach to neurosurgery that is both balanced and aggressive. So, welcome to our show, Doctor. Thank you so much.
Thanks a lot. Thank you so much for having me. It's my pleasure to be on your show.
Thank you.
Thank you, Doctor. The first question that I would like to ask you is, what are the changes that the brain goes through as we age?
So the aging brain is quite an interesting phenomena. So from the time you're born, you start aging in some sense. And like other parts of the body, the brain tends to lose a little bit of volume. It tends to shrink a little bit. The blood vessels of the brain, they start to become atherosclerotic. You start developing some calcium plaques along the vessels. There's some narrowing of the vessels. This is why the blood flow to the brain, which is hampered occasionally in the adults, and that's how you get strokes, and that's how you get ischemic problems, and that's where problems like dementia tend to set in. So overall, the brain tends to atrophy a little bit. Neurons usually, which they tend to degenerate at a faster level, and occasionally you can have the ventricular spaces, the space where of the brain that contains fluid. As the brain shrinks, those can enlarge a little bit and cause some problems, especially in the elderly. So those are the things that physiologically take place at we age, and in some people it happens in an accelerated fashion, and in some people it happens very, very slowly, gradually, in a stepwise manner.
Okay. So can I ask you a question? You mentioned that in some people it happens in an accelerated fashion. Is that to do with some diseases or something connected to that?
So it's just associated with generalized risk factors. For example, diabetics, hypertensives, patients with heart disease, they are prone to have an accelerated pattern of degeneration. Again, in those, there are some who won't follow that dictum, and there are some who will. So it's really difficult to pinpoint which patients would be subjected to having those problems. Example, various kinds of dementia. There are some patients who progress very rapidly with dementia or forgetfulness, and there are some patients who have a very, very gradual decline. It's very difficult to predict still with the given information that we have which ones will go in which direction.
Oh, I see.
Doctor, what are the tips to keep the brain healthy, young, and active?
So there's really actually no rocket science to those tips. A diet forms a great tool, and eating right is very important. First of all, you have to reduce your intake because we don't need the quantity of food that we eat. It's also important that we reduce the carbohydrate intake, and there's something called as brain-rich foods. So foods that are rich in enhancing the potential of the brain. For example, berries, all kinds of berries, blueberries, blackberries, strawberries, ground nuts, various kinds of nuts. Omega-3 fatty acids are good. So fish, cod liver oil, eggs, and obviously the whole bunch of fruits and green leafy vegetables. All of those things are very, very healthy for the brain. Again, keeping active in some form, both mentally and physically, extremely essential. You have to keep as mobile as possible, right from your, especially when you get older. Try and walk when you can use the car. Try and use the stairs when you can use the elevator. As far as possible, keep as mobile. That brings a great deal of wellness to brain health. And sleeping appropriately, the correct amount. Every person requires a different amount of sleep, and it can vary from 5 to 9 hours. Roughly 7 to 8 hours is the average where most people sleep. So getting the right amount of sleep, performing at least moderate amount of exercise 4 to 5 times, brisk walking, eating the right kind of food, keeping your weight down, and then keeping mentally active. There are tons of things. In people say that having a hobby really helps the brain, or keeping active, solving Sudokus actually is not a myth. It does keep your brain active. Learning another language, even in an elderly age group, keeps the brain active. Some people say that performing tasks with the hand that you're not used to performing them, like for example, if you brush your teeth with the right hand but you start brushing with the left, start doing things ambidextrously. Those are things that also keep the brain really active. So this is not very hi-fi stuff. It's all basic stuff that one can follow, but it's really hard to follow. Obviously, we now have a lot of evidence that some form of a meditative practice, any form of a spiritual practice, 10-15 minutes a day. The Art of Living guys have done tons of studies. Maharishi's workplace have done tons of studies on transcendental meditation. Various people have conducted. Now you have scientific evidence that meditation really helps attentiveness, focus, calculation, all of those things. And especially in the elderly, um, who can't complain that they don't have much time, they can really involve themselves in trying to do any of these things, and that will keep the brain pretty sprightly.
Thank you.
So we keep hearing, doctor, that as they grow older, seniors complain that then we can't remember, so they have a lot of memory issues.
Yeah.
So when does that start, and how do you? I think some of the things that you already mentioned will help with the memory issue too.
Yes, of course. So I mean, a fading memory or a declining memory is just a natural process of aging. Uh, when we just forget things like keys and names, and that happens to even us, that's not a big deal. But if it progresses to a stage where you've forgotten what you've eaten for breakfast, and you've forgotten what someone's just told you 2 minutes ago, uh, and it happens consistently, and it's hampering your quality of life and your daily living, then it's a problem. And the scientific term is dementia, and you have multiple forms of dementia like Alzheimer's dementia and frontotemporal dementia, and then there are various other forms of dementia. So those usually set in by the 60s, and then the rise is exponential with each decade. They say that about 80% of people in the 80s will have some form of dementia. And again, like I said, in some people it progresses very slowly, and in some people it progresses rapidly. There are certain reversible causes of dementia that one should be aware of. And when we talk about reversible causes, sometimes simple things like vitamin B12 deficiency can cause forgetfulness. Thyroid dysfunction can cause forgetfulness. Sometimes the elderly people, have something called as a chronic subdural hematoma. They just have a collection of blood in the brain. They might have bumped their head somewhere. They don't even remember it. And that can also be a cause of forgetfulness. Very rarely, brain tumors in the elderly can be causes of forgetfulness. So you should, if someone's having a memory problem that's significantly hampering their day-to-day functioning, they should get an MRI of the brain without fail. And with that, you will have some clarity as to what kind of problem it is, what kind of dementia it is. You can even classify the dementia with certain MRI protocols. And then there are some treatments available in terms of reversible dementias, but in some things like Alzheimer's, there's only really supportive care that's possible. There are some medications which may help gradually decrease the progression, but there's no real cure for it.
Okay. Just continuing the conversation, what are the top 5 red flags that caregivers around the seniors need to be aware of when it comes to, memory or brain function declining, that they know that we have to approach the doctor?
Yeah, so for example, if you're forgetting recent stuff, like recent memory loss, like I told you, what you've eaten,
Right.
what someone's told you very recently, and you've lost your way to come home, or you don't know whether you're going to the way you're sitting in the bedroom or in the hall, those kind of things. That's concerning. Supposing you've started having imbalance while walking,
Okay.
along with that, that's concerning. If you're having problems with passing urine control, you had urine control a couple of months ago and now you can't control it. Either you have urgency of urine, or you're not able to get to the washroom in time and you pass urine in bed. Those are concerning features. If there's any amount of forgetfulness that's associated with headache, sometimes vomiting, double vision, those are the things that you should not ignore, and address. Get a physician to take a look, let them examine, let them evaluate. Getting a baseline MRI is very effective and helpful for to a great extent. It really sorts out whether there's any underlying or structural problem for dementia, or it's something that is just a progressive kind of dementia which really doesn't have any cure. But there is, in some sense, a burden on caregivers also for treating patients with dementia. It really takes a toll on them, and they also need to be supported, and they need to be there are support groups for caregivers as well, and they need to be guided as to what they should do, how they should take a break from the person they're taking care of, what are the activities that they should indulge in, etc., to keep their mind and body up and about.
The first thing that they should do is look for these signs, and if they see it, they go to the physician and then
Yes.
get an MRI done.
Yeah.
And then the physician would suggest to take the MRI to a neurosurgeon like you, right?
That's right. Yeah. And some basic blood work, like I told you, vitamin D, vitamin B12, thyroid function, just basic liver, kidney. If all of those, sometimes, just simple things like urinary tract infections in the elderly can
Okay.
cause memory impairment, can cause
Oh.
dementia, can cause forgetfulness.
Oh.
That is actually more common than these other causes that I mentioned. Uncontrolled diabetes, big factor of that can cause forgetfulness. So those are the things also that need to be looked at very effectively and very closely, and not be neglected.
Right. So, doctor, thank you so much. The information that you gave, the tips that you gave are so informative, and I'm sure it's going to benefit seniors as well as their caregivers. Thank you once again
Thank you so much.
for coming to our channel, and cheers to wellness.
Cheers to wellness.
Yeah, I don't have a glass with me, so
Cheers.
Sure.
thanks.
As long as it's a water bottle.
Yeah, in the hospital we don't have alcohol.
Okay.